In our last presentation, we discussed male infertility. We appreciated that for a couple that is struggling to have a child, 50% of the cause can be attributed to male factor. There are several male factors that have been identified to contribute to male infertility. One of those male factors that I discussed last time was about poor quality of sperms. But we also saw that infections could be responsible for causing poor quality of sperms. Today, we are going to go deep in understanding how infections can result into infertility in men, or how infection can result into male infertility. Well, before we understand how infection result into male infertility, I want us to look at this simplified diagram of a male reproductive system. We see that it has different structures which include the testis, the vas deferens, the seminal vesicles, and the urethra, as well as the prostate. Each of these structures that is listed here plays a very key important role to determine fertility in men. So, what are the roles played by each of these factors? So what are the roles played by each of these organs that we have mentioned in reproduction? Well, we look at the testis. Take this to be a factory where sperms are manufactured. Throughout our lifetime as men, testis is the only source of the sperms. And after these sperms have been produced in testis, for them to be delivered to the female reproductive system, there must be channel through which these sperms are going to be delivered. And part of that channel include the vas deferens that act as a conduit for delivering sperms from the testis. And then we have the seminal vesicles that are responsible for forming an ejaculum. We also have the prostate that also produces an ejaculum, which is the fluid that is contained, which is the fluid in which the sperms are contained. We have the urethra, which is the final channel through which sperms are delivered into the reproductive system of a woman. But importantly, what we have not listed here are the hormones that are produced within our body that help to fuel our desire to have intercourse and the body's ability to produce the sperms. So, what goes wrong in this system in relationship to infection so that infertility occurs? We shall look at the commonest infections that are transmitted or that affect this the male reproductive system. And these infections include chlamydia and gonorrhea. These are regarded as the big two. Why the big two? It's because they occur commonly, and most importantly, they can be asymptomatic. Asymptomatic in a sense that someone will have this bacteria within the reproductive system or the urinogenital system without necessarily having symptoms. And for that matter, they can keep transmitting the infection, and the infection can as well progressively affect their reproductive system. Another important infection is prostatitis. Prostatitis is when a bacterial infection affects our prostate. And we have seen that a prostate is one of the organs that is very key in forming the fluid that we have seen that a prostate is one of the organs that produces the fluid in which the sperms swim as they are delivered to the female reproductive system. So any infection that can affect the prostate can affect the quality of the sperms, or can affect how the sperms will swim towards the female reproductive system. There is another important infection called epididymis. This part, which we had not labeled, is called an epididymis. And this is where sperms are temporarily stored after they have been manufactured by the testes. And if this store gets infection, it can affect the quality of sperms, and this can eventually affect the fertility. Another important infection is mumps in adults. Mumps in adults, mumps in adult males can result into infertility. We shall explain later how this can happen. So, what really goes wrong during infection of the reproductive system of male that will result into infertility? There are two things that normally happen in the presence of infection that can result into male infertility. One is the blockage of pathway. We have seen that sperms travel a very long journey as they are a very long journey for them to reach the female reproductive system. And the pathway can be blocked. That is to say, the vas deferens can be blocked, the urethra can be blocked, and even the epididymis itself can be blocked. How does this happen? Is that when your body is attacked by bacteria, it mounts an immunological response in an attempt to clear this infection. How does this come about? Is that when your body or when the reproductive system is affected by the bacteria, the body will mount an immunological response, and this response will cause a lot of inflammation. And if this is not addressed by the medical doctor, the pathway will heal by scarring, and these scars will block the delivery of the sperms. Another important thing that happens during infection is the direct attack of the factory. Is that infections like mumps, they can directly affect the testicles and cause what we call orchitis. Orchitis is the infection of the testes that can result from infections like mumps or even bacteria and other viruses. This will directly affect the ability of the sperms to this will directly affect the ability of the testicles to produce sperms, and this subsequently can cause infertility. Another important aspect that happens during infection is the fever and inflammation. We have already explained how inflammation will result into scarring and subsequently blockage of the pathway through which the sperms are delivered into the reproductive system. But fever is another important thing. Fever is produced as a result of inflammation when your body is trying to fight infection, and this fever will raise the temperatures within the testicles. Remember, the testicles have to be outside, are naturally outside, and the most important reason why they are outside is that they must be at lower temperatures of at least 3 to 4 degrees centigrade as compared to the body temperature. And this gives them an optimal environment to be able to produce sperms. But when the infection raises the fever, or the infection causes fever, this fever can affect your testicles and subsequently their ability to produce sperms. Another important aspect is a weakened army, if you like, that your sperms will be weakened as a result of the infection, and their quality and quantity will greatly be affected by infection, and subsequently you can become infertile as a man due to infection, especially if this infection is not diagnosed and treated timely. So, having said that, we would like to understand what one needs to do if he finds out that he has infection. Well, there are several symptoms that one can present with in the presence of a urinary tract infection or a sexually transmitted infection. It could be urethral discharge. Someone has a discharge through his urethra, and this discharge could be pus. It could be bloodish, but also importantly, this patient is going to have pain while passing urine, and may also have symptoms of urge to pass urine frequently, but can also have lower abdominal pain. So once you have those symptoms, it is very important that you seek help from a doctor. But how do we prevent having this infection? The most important aspect in prevention is safe sexual practices. We have to be faithful to our partners. If that is not possible, then we must protect ourselves by putting on condoms correctly and every time we are going to have sex. This will prevent us from having these infections. Vaccination is very important. Mumps vaccine can prevent mumps. And also general health. We have to make sure that our general health is good in terms of nutrition, in terms of physical exercise, in terms of seeking health care or visiting doctors every time we feel unwell. So what is the treatment? The treatment is simple. Once your doctor has done relevant investigation, which is usually a urinalysis, checking your urine, and if this urine shows presence of infection, your doctor will give you antibiotics depending on the sensitivity in the area where the doctor is practicing, or according to the guidelines that are stipulated in that area where the doctor is practicing. So it's very important for us to understand that in the presence of a sexually transmitted disease or infection, both partners need to seek health care so that if both of them have the infection, it can be treated. Otherwise, there will always be reinfection. As we come to the conclusion of this presentation, we would like to say that infection are a notable cause of infertility in men, but the good news is, if diagnosed early, this can be treated, and if we observe the advice that we have given, they can be prevented. Every time you have the symptoms suggestive of sexually transmitted disease, please seek health care. And if you have a problem of infertility resulting from sexually transmitted diseases, consult a urologist or a reproductive endocrinologist. He will be able to make a proper diagnosis and treat you accordingly. With this, we come to the end of our presentation. Thank you for listening to me. If you think that this video has been important to you, please share it with your colleagues, like and comment on this presentation so that we can be able to continue to make more videos. Thank you for listening to me.